afternoon, everyone. This is Christine at Health Current, and thank you for joining us for the Program Year 2021 Stage 3 Requirements webinar. This presentation is provided through a shared commitment between Access, Health Current, and Myers and Stofers to increase participation in the Medicaid Promoting Interoperability PI program. A few logistical reminders. Today's webinar will be recorded and posted to the Health Current and Access websites. We encourage you to use the chat box for questions or comments. Please do not include any name, practice, organization. Do not include any confidential information such as patient health information or PHI. Again, we are muting all lines today. And I believe Connie Ide, are you with us? Oh, there you go. I can hear you.
All right, very good. Thank you, Christine. We're very lucky today to have Priscilla Clark as a senior accountant for Myers & Stoker, a certified public accounting firm specializing in federal and state Medicare and Medicaid programs, as our webinar presenter today. She's very experienced and has a wealth of knowledge, so we're very lucky to have her. So Priscilla, please begin your presentation.
Thanks, Connie and Christine. So today we will be discussing Program Year 2021 Stage 3 objectives. And we have a lot of information to cover. So there will be some items that we'll just talk about briefly. And then if you have any questions, feel free to put them in the chat box. And we'll answer those at the end of the presentation. Okay, the learning objectives for today's webinar is first to understand Stage 3 requirements for the Medicaid Promoting Interoperability Program. Also, the second learning objective is to understand the differences between Program Year 2020 and Program Year 2021. And then third, to learn about Program Year 2021 Stage 3 documentation requirements. Meaningful use. So the HITECH Act description, the Recovery Act specifies the following three components of meaningful use. First, that the use of the CERT is used in a meaningful manner. The use of CERT for electronic exchange of health information to improve quality of health care. And then third, the clinical quality measures, which is the use of CERT to submit CQMs and other such measures selected by the Secretary. Just to go over a couple of the meaningful use health outcome priorities. One of them is to improve quality, safety, efficiency, and reduce health disparities. Also to engage patients and families in their health care, to improve care coordination, improve population and public health, and ensure adequate privacy and security protections for personal health information. We're going to do a brief overview of the requirements of the program, and then we'll dive in deeper to each of the requirements. So this slide covers all the different requirements the provider needs to meet for meaningful use. So EPs are required to attest to Stage 3 for meaningful use for Program Year 2021. All EPs must have a 2015 Edition Cert implemented. There are 8 objectives, and the related measures must be met. 5 of those objectives are percentage-based measures, and then 3 of those objectives are yes/no measures. If exclusions are selected by the providers, the provider must meet the exclusion criteria. The provider must report on a minimum required number and type of eCQMs. The provider must maintain at least 80% of all unique patient data in CERT. And then the provider must also perform at least 50% of all encounters at locations with CERT. As you can see towards the bottom of the screen, there is a hyperlink to the documentation retention webinar that provides even more detail behind the types of documents that are accepted for the program. That link will take you to the Access website where you'll be able to see multiple different presentations, including this one. So for Program Year 2021 Meaningful Use Reporting Period links, there's 2 different reporting periods for this. The first one is the PI reporting period. It's 90 days for all EPs, and the reporting period must be within calendar year 2021, and the end of the PI reporting period must fall on or before October 31st, 2021. Keep in mind that this is the last year of the program, so this 90-day period, the last day of that period must be on or before October 31st. So make sure you're keeping aware of that date. And the data attestations will close on October 31st, 2021. For the ECQM reporting period, you'll see that it's also 90 days for all EPs, and it has the same requirements in that it has to be within calendar year 2021, but the end of the CQM reporting period must fall on or before October 31st, 2021. Keep in mind that these two different 90-day reporting periods do not have to line up. So the provider could select their PI reporting period to be January 1st through the end of March. And then their Cqm reporting period could be August 3rd to October 31st. So those do not have to line up exactly. And then for the 2015 Edition Cert that has to be implemented for program year 2021, it does not have to be implemented by January 1st, 2021. However, the cert must be implemented by the first day of the PI reporting period. And the cert must be certified by ONC as a 2015 edition product by the last day of the PI reporting period. For example, the 2015 edition may have been implemented by the practice before the start of the PI reporting period, even though the product is still pending ONC certification. However, the certification must be approved by ONC by the last day of the PI reporting period. You can go to the ONC website by the link at the bottom to learn when various cert products were certified in case you are worried that the EHR that's implemented at your practice may not be certified for the 2015 edition. Documentation requirements, what do we look for when we're reviewing that document that you submit to support the 2015 edition cert? So the cert documentation should include the date the 2015 edition cert was implemented, the edition number, and the practice name. Some examples of these documents could be a cert contract or a vendor letter, but keep in mind there's 3 items listed on the slide: the date, the edition number, and the practice name needs to show up on whatever type of document you do submit. So for general requirements, so there's 2 types of general requirements that providers must meet for this program. They must maintain at least 80% of all unique patient data at locations with cert in the cert. The second general requirement is that the provider must perform at least 50% of all encounters at locations with cert. So EPs who practice in multiple locations must have 50% or more of their patient encounters during the PI reporting period at a location or locations equipped with cert. The documentation that we generally accept for general requirements would require the provider to submit their detailed encounter listing for the reported 90-day PI reporting period in Excel containing the following fields: the patient name or a unique identifier. That unique identifier needs to be unique to the patient and not the patient visit. So if the patient is seen twice during that PI reporting period, that identifier should remain the same. Another column that is required is the date of service, the date of birth, the location name for where that patient was seen, and then identify which locations do not have data maintained in the cert if they were seen at a location that has cert. We're going to go over a few definitions of the different documentation terms we're going to be using throughout this presentation. So EPs are required to upload documentation for each measure. The following slides describe the documentation required for each of those measures. The first one is going to be the standard documentation. There are 2 standard types of documentation. There is the yes/no standard documentation and then the percentage-based standard documentation. Then there's going to be the additional documentation. This will require the EP to submit the standard documentation and then the additional documentation listed. The other type of documentation that might be requested, and I'm getting a little feedback, so if everyone can make sure that they mute their line, thank you. So the third type of documentation that can be requested is the alternate documentation. The EP has the option to submit alternate documentation in lieu of the standard documentation. Here's just a summary of the stage 3 objectives. So it goes through all 8 objectives. In the first column, it labels what number it is. Then it says the objective name. The third column says the type of measure. Is it a yes, no, or is it a percentage-based measure? The fourth column is labeled documentation, and it's telling you what type of documentation is going to be required. As you can see for objective 1 for protect patient health information, we're telling you to go and look at the SRA webinar. In the far right column is the resources that you can click on to go to each of those presentations that have been created. And it's going to tell you what type of documentation is requested. For the second item, electronic prescribing, you can see in that fourth column over to the far right, it says percentage-based standard. That means that the provider should be submitting the percentage-based standard documentation. Again, please keep your lines muted because there is some feedback coming in. And then as you go down through each objective, you'll see what type of documentation is required. So for clinical decision support, which is the third objective, we would require you to submit the yes/no standard documentation. There are times where if the provider claims the exclusion, then additional documentation may be needed. So for the percentage-based measure standard documentation, unless otherwise specified, the provider should submit the CERT dashboard for all percentage-based measures. The CERT dashboard should reflect 4 things: the correct PI reporting period, it should include the provider name, it should reflect all percentage-based measures, and it should match the attestation. Please keep in mind that correct PI reporting period, the last day of that reporting period needs to be October 31st, 2021 or sooner. It cannot be after October 31st. If attesting to an exclusion for a measure, the CERT dashboard may be utilized to support meeting the exclusion criteria for certain measures. If the exclusion is not supported by the CERT dashboard, additional documentation is required. Now let's discuss the yes/no standard documentation. The CERT dashboard alone cannot be used to support these measures. The documentation could include screenshots from the CERT or vendor letters to support the applicable functionalities were enabled or the actions required were performed. The documentation submitted is going to be checked for 4 items. It should include the provider or practice name. It should reflect results for the measure. It should be clearly legible, and it should reflect the date the requirement was met. This next slide here, it shows us the appropriate dates of the supporting documentation, and those dates can vary depending on the measure. For security risk analysis, the SRA must be completed inside calendar year 2021, but no later than December 31st, 2021. So you must complete and date your SRA by December 31st, 2021, but keep in mind, if you need it dated inside the calendar year for 2021. For clinical decision support, otherwise known as CDS, and drug-drug and drug allergy interaction checks, it should reflect the date the requirement was met during the PI reporting period. So you have a 90-day PI reporting period. Make sure the documentation you submit supports CDS, drug-drug, and drug allergy interaction checks were turned on during that 90-day period. Then public health measures, it should reflect a date within 60 days of the start of the PI reporting period. Providers that completed registration in a previous year meet active engagement option 1. Here is another table summarizing the compliance for stage 3. So again, on the far left, it does list the 8 different objectives. It tells you in the third column, the compliance column, that all EPs need to meet every single one of these measures. In the fourth column, it talks about the EP state exceptions, and it goes down the list telling you which measures have exceptions that are allowed. Then in the next column is the exclusions column, and it tells you if there's exclusions just generally allowed by CMS. And so you can go down that to see that whether there are exclusions or not. For protect patient health information, which is objective 1, no exclusions are available to any EPs for that. And in the last column, it tells you how many measures are inside each objective. So for protecting patient health information, it says not applicable because there's only one objective. There's not multiple measures inside that objective. However, if you go down to the third objective, which is clinical decision support, you can see in the far right column that there's a measure 1 and a measure 2. Keep in mind for the public health reporting towards the bottom, which is objective 8, there are multiple different registries inside of it that you can attest to. So there's immunization registry reporting, syndromic surveillance, multiple different measures that a provider needs to meet. Keep in mind for the immunization registry reporting, it requires bidirectionality in order to meet the measure. And then when it comes to public health registry reporting, the state of Arizona does have a cancer registry, and the registry accepts EP submitting data if their specialty as listed at the bottom. So there's only a select range of specialties that the cancer registry allows those providers to submit data to. This table summarizes all the different exclusions that are allowed. For each of the objectives, keep in mind that if a provider does claim one of these exclusions, they will need to potentially submit additional documentation to support that the provider meets that exclusion. So when you're going through the attestation and EPIP, make sure you go ahead and ensure that you have documentation to support that you meet one of those exclusions. Please keep in mind that for Objective 5, 6, and 7, patient electronic access, coordination of care, and health information exchange, there is an exclusion called Broadband. That is not allowed for EPs in the state of Arizona per CMS guidance. Okay, moving on to the CQM requirements. EPs must attest to 6 out of 47 available CQMs. 6 of those 47 are outcome measures, 27 are high priority measures, and 14 remaining measures that are not outcome or high priority. Keep in mind, so CMS has set guidance for priority level 1, which is, if relevant, at least one CQM of those 6 the provider attests to should be an outcome measure. Keep in mind, at the top of the slide, it does say that there are only 6 outcome measures. Now, what happens if a provider does not have an outcome measure that is relevant to their scope of practice? Well, then the provider is allowed to move to priority level 2, which is if no outcome measures are relevant, at least one CQM should be a high priority measure. Keep in mind, there's a lot more high priority measures. There's 27 of those. And then if there is no outcome or high priority measures, that provider can move to priority level 3, which is that they can attest to any measures. So they can attest to some of those 14 CQMs that are not outcome or high priority. This link at the bottom does take you to the Access website where you can review and see the webinar for clinical quality measures. Keep in mind that currently the Access website has the clinical quality measures for program years 2019 and 2020. The webinar for program year 2021 will be conducted on February 25th, 2021. And so you can go to the Access website or the Health Current website to sign up for that webinar and gather more information. So what type of documentation is sufficient? The provider needs to run a Cqm report from the cert for the appropriate reporting period. They need to prove the Cqm data was calculated by 2015 Edition Cert. So for example, the report must show the cert name or screenshots demonstrating how the report was pulled from the cert. The report should include the following: the required number and type of CQM, the numerator and denominator for each CQM, the most recent CQM version the cert has available, and the proper reporting period. So on previous slides, we identified that the provider needs to attest to 6 CQMs and that the 90-day reporting period must fall the last day on or before October 31st, 2021. Here's just a brief overview of what has changed from program year 2020 to 2021. And so the only things that have changed is the reporting period deadlines and dates. So for that first item, it talks about the PI 90-day reporting period. In 2020, providers were allowed to attest to a 90-day period anytime within calendar year 2020. However, for 2021, the provider their 90-day reporting period must fall within calendar year 2021, but the last day must end on or before October 31st, 2021. The same thing goes for the CQM reporting period. For program year 2020, again, they were able to attest to a 90-day reporting period anywhere inside calendar year 2020. However, for program year 2021, that 90-day reporting period must fall within calendar year 2021, but end on or before October 31st, 2021. And then the last item that changed was the SRA completion date. For program year 2020, providers must have completed the SRA on or after the end of the PI reporting period and no later than December 31st, 2021. However, in program year 2021, CMS has allowed more additional guidance in helping providers because the payments must be completed by December 31st, 2021. So the SRA that the providers complete must be completed inside calendar year 2021, but no later than December 31st, 2021. So you're able to complete that SRA during that 90-day reporting period. Okay, moving on to meaningful use objective details. So we will be going over each objective and what type of measures and exclusions are available for that objective. So the first objective is protecting patient health information. So the objective is to protect electronic protected health information, otherwise known as PHI, created or maintained by the CERT through the implementation of appropriate technical, administrative, and physical safeguards. The measure is to conduct or review a security risk analysis. A security risk analysis should contain a layered approach and be dated appropriately. Although there is no specified method that guarantees compliance, there are several elements a risk analysis must incorporate regardless of the method employed. It must contain an asset inventory. It must contain physical, administrative, and technical safeguards. It must identify threats and vulnerabilities. It should determine the likelihood of threat occurrence. It should determine the potential impact of threat occurrence. It should determine the level of risk. And then it should also identify remediation or an action plan. At the bottom, you can click on the hyperlink to look at the SRA webinar that was specifically created for program year 2021 regarding these requirements. The SRA must be completed inside calendar year 2021, but no later than December 31st, 2021, and must show the date completed. There are a few examples here just listing out when that SRA needs to be dated. So the first example, the PI reporting period is January 1st, 2021 through March 31st, 2021. A provider must complete the annual SRA anytime between January 1st and December 31st, 2021. And as you can see for all of the remaining examples, regardless of when that PI reporting period is, the provider has the option of completing the annual SRA between January 1st and December 31st, 2021. Keep in mind that the SRA report must include the completion date, the month, the day, and the year. And then the next slide explains when the SRA must be submitted to Access. For program year 2021, attestations will close October 31st, 2021. And there are certain practices that do not complete their SRAs until the last month of the year. And so Access is allowing providers more time to assist them with completing and attesting for the EHR program. So the SRA must be completed, as we said, inside calendar year 2021. Attestations for program year 2021 will close October 31st, 2021. And EP is allowed to submit the SRA after the attestation close date. However, keep in mind that the SRA must be submitted to Access by January 14th, 2022. So although, for example, say there is a provider who completes their SRA December 30th. We want you to submit that SRA as soon as possible, but Arizona is allowing you leeway and time to submit that SRA by January 14th, 2022. However, your SRA needs to be completed and dated by December 31st. You do not have until January 14th to complete your SRA. That 14-day period is allowing you to submit that SRA, but not to complete it, because you should have already completed it and dated it by December 31st. An EP incentive payment will be recouped if the SRA is not submitted by January 14th, 2022, or if it does not meet all the SRA requirements. Access does recommend that the EP complete, dates, and submits the SRA by October 31st, 2021, or as soon as possible. Moving on to Objective 2, electronic prescribing. The objective is to generate and transmit permissible prescriptions electronically. The measure is that more than 60% of all permissible prescriptions written by the EP are queried for a drug formulary and transmitted electronically using a cert. The exclusion, there's two of them. So the first one is the EP is not required to submit data or meet the measure, and when they claim those exclusions. And the EP must submit documentation for how he or she meets the exclusion. The two exclusions for electronic prescribing is the first one is the number of permissible prescriptions criteria, and the second one is the pharmacy proximity criteria. So for the first one, the EP must write fewer than 100 permissible prescriptions during the PI reporting period. The second exclusion is that the provider does not have a pharmacy within their organization, and there are no pharmacies that accept electronic prescriptions within 10 miles of EP's practice location at the start of his or her PI reporting period. So what type of documentation is required? So the first bullet point discusses what documentation is required if the provider attests to meeting the measure. They need to submit the percentage-based standard documentation that's discussed on slide 14. And some examples of that supporting documentation is in the documentation retention webinar. However, if the provider does claim the exclusion, they will have to submit additional documentation. So if the EP first exclusion is writes fewer than 100 permissible prescriptions, the provider would need to submit the standard documentation, which would be the CERT dashboard showing that the EP wrote fewer than 100 permissible prescriptions during the reporting period. However, there is alternate documentation. The provider can submit documentation other than the CERT dashboard that demonstrates the EP has fewer than 100 permissible prescriptions. Now, if the provider takes the no pharmacy within organization or within 10 miles of EP practice exclusion, they would need to submit additional documentation showing the closest pharmacy to the practice at the start of the PI reporting period. That documentation should demonstrate how the provider determined no pharmacy is within 10 miles of the practice. Again, for additional information, you can see the electronic prescribing webinar. Moving on to Objective 3, Clinical Decision Support. The objective is to implement clinical decision support, CDS interventions focused on improving performance on high priority health conditions. There are two measures. The first measure is to implement 5 CDS interventions related to 4 or more CQMs at a relevant point in patient care for the entire reporting period. Absent 4 CQMs related to an EP schedule practice or patient population, the CDS interventions must be related to high priority health conditions. Measure 2 is to enable and implement the functionality for drug-drug and drug allergy interaction checks for the entire reporting period. For the exclusions, again, the EP is not required to submit data or meet the measure when they claim the exclusion. The EP must submit documentation for how he or she meets the exclusion, though. There is only one exclusion available, and that is for Objective 3, Measure 2, which is the drug-drug and drug allergy, and it is the number of medication orders criteria. So it is when an EP may take the exclusion for Measure 2 if the EP writes fewer than 100 medication orders during the reporting period. Documentation to support both of those measures would require the yes/no standard documentation, which is on slide 15. Examples of supporting documentation to meet this measure are included in the CDS webinar link. For exclusion documentation, it's when the EP writes fewer than 100 permissible prescriptions. There are 2 options that a provider can submit to support that they meet the exclusion. The first one is the standard documentation, which is the CERT dashboard showing that the EP wrote fewer than 100 medication orders. The second type is alternate documentation. So it could be something other than the CERT dashboard that demonstrates the EP has fewer than 100 medication orders. Moving on to Objective 4, Computerized Provider Order Entry. The objective is to use CPOE for medication, laboratory, and diagnostic imaging orders directly entered by any licensed healthcare professional. An EP, through a combination of meeting the thresholds and exclusions, or both, must satisfy all 3 measures for this objective. The first measure is that more than 60% of medication orders created by the EP during the PI reporting period are recorded using CPOE. Measure 2 is that more than 60% of laboratory orders created by the EP during the reporting period are recorded using CPOE. The third measure, again, is more than 60% of diagnostic imaging orders created by the EP during the reporting period that are recorded using CPOE. Again, for exclusions, the EP is not required to submit data or meet the measure. However, if the EP must submit documentation of how he or she met the exclusion. There are 3 different exclusions for Objective 4. First one is the number of medication orders criteria. Second is number of laboratory orders criteria. And the third is the number of diagnostic imaging orders criteria. So an EP may take an exclusion for the appropriate measure if, for Measure 1, the EP wrote fewer than 100 medication orders during the reporting period. For Measure 2, the EP wrote fewer than 100 laboratory orders during the reporting period. And then for Measure 3, an EP wrote fewer than 100 diagnostic imaging orders during the reporting period. let's discuss the type of documentation that is acceptable for CPOE. If the provider is attesting to meeting the measures, they need to submit the percentage-based standard documentation, which was discussed on slide 14. Examples of supporting documentation to meet this measure are included in the documentation retention webinar link. When it comes to exclusion documentation, so when the EP wrote fewer than 100 orders for the applicable measure, they had two options to submit documentation supporting that exclusion, or all three exclusions. The first option is the standard documentation. The CERT dashboard should show that the EP wrote fewer than 100 orders for the applicable measure during the PI reporting period. The second option is the alternate documentation, which is documentation other than the CERT dashboard that demonstrates the EP wrote fewer than 100 orders for the applicable measure. For additional information, you can look at the CPOE webinar provided in the link at the bottom. Moving on to Objective 5, Patient Electronic Access. This is the EP provides patients with timely electronic access to their health information and patient-specific education. There are two measures for this objective, and EP must satisfy both measures for this objective through a combination of meeting the thresholds and exclusions. Measure 1 is that for more than 80% of all unique patients seen by the EP, the patient is provided timely access to view online, download, and transmit his or her health information. Keep in mind that timely per CMS means the information is provided to the patient within 48 hours of the information being available to the provider. Then also the second requirement for that measure is the provider ensures that the PHI is available for the patient to access using any application of their choice that is configured to meet the technical specifications of the application programming interface, otherwise known as API, in the provider's CERT. Measure 2, the EP must use clinically relevant information from CERT to identify patient-specific educational resources and provide electronic access to those materials to more than 35% of unique patients seen by the EP during the reporting period. Again, when claiming exclusions, the EP is not required to submit data or meet the measure. However, the EP must submit documentation for how he or she met the exclusion. There are two types of exclusions for this objective. The first one is the no office visits criteria, and the second one is the broadband criteria. For measures 1 and 2, the EP may take an exclusion for either measure or both if either of the following apply. The first exclusion is that the EP has no office visits during the PI reporting period. The second exclusion is the EP conducts 50% or more of his or her patient encounters in a county that does not have 50% or more of its housing units with 4 megabytes per second broadband availability, according to the latest information available from the Federal Communications Commission on the first day of the reporting period. So we're going to discuss broadband access exclusion. For program years 2015 through 2017, CMS identified the counties in the U.S. who conducted 50% or more patient encounters in a county where 50% or more of its housing units do not have 4 megabytes per second broadband availability and therefore meet the broadband exclusion. The state of Arizona does not have any counties listed. Therefore, an EP in Arizona is not able to meet this exclusion. The tip sheet from CMS regarding broadband access exclusion is at the very bottom of this slide if you do want to review it. CMS has not published an updated list of the counties. However, the majority of counties in the U.S. have increased their broadband availability and still do not meet the requirements for the exclusion. It is unlikely that broadband availability would have decreased since the CMS tip sheet was published. So documentation for patient electronic access. When meeting the measures, the provider should submit the percentage-based standard documentation. Additional documentation might be needed to determine the documentation necessary to support meeting this measure. You can click on the Patient Electronic Access webinar. So make sure when you are testing for this objective that you go in and review the webinar for this objective. Now, if the provider attests to an exclusion, the first exclusion being the EP has no office visits during the reporting period, the provider would need to submit additional documentation. And that documentation would need to show the place of service code for all encounters during their PI reporting period to ensure the provider did not see any office visits. The second exclusion, which is the broadband access exclusion, is not available to Arizona EPs. Moving on to Objective 6, coordination of care. There are 3 measures for this. And the objective for this is to use the cert to engage with patients or their authorized representatives about the patient's care. Measure 1 is that more than 5% of all unique patients seen by the EP actively engage with the EHR made accessible by the EP and either 1, view, download, or transmit to a third party their health information, or 2, access their health information through the use of an API that can be used by applications chosen by the patient and configured to the API in the EP cert, or 3, which is a combination of 1 and 2. Measure 2, for more than 5% of all unique patients seen by the EP during the reporting period, a secure message was sent using the electronic messaging function of CERT to the patient, or in response to a secure message sent by the patient or their authorized representative. Measure 3 is patient-generated health data or data from a non-clinical setting is incorporated into the CERT for more than 5% of all unique patients seen by the EP during the reporting period. An EP must meet the minimum threshold for 2 of the 3 measures or meet 1 of the 2 available exclusions. The exclusions for all 3 measures are the same. If the EP meets 1 of the exclusions, they can meet the exclusion for all 3 measures. Some examples of possible combinations are included in the table. In the far left column, it says whether the provider would pass or fail depending on the scenario on that row. So let's go through the first scenario. It's showing the provider is passing, but for measure 1, it shows the provider meets the threshold. For measure 2, again, they're meeting the threshold. However, for the third measure, they do not meet the threshold. This is not required because the provider only needs to meet 2 of the measures underneath this objective. For the second scenario, it shows the provider meets the threshold for measure 1 and then the exclusion for measure 2 and 3. This provider is passing because although they only met the measure for 1, the threshold for measure 1, they then met the exclusions for measures 2 and 3. The third example shows that the provider attested to the exclusion for all 3. And keep in mind that the 2 exclusions that are available underneath this objective is available for measures 1, 2, and 3. Now, in the last scenario, it shows that the provider is failing because the provider does not meet the threshold or exclusion for measures 1, 2, or 3. Again, the EP is not required to submit data or meet the measure when claiming the exclusion. However, the EP must submit documentation for how they might meet the exclusion. The exclusions for Objective 6 is the office visit criteria and then the broadband criteria, which was discussed earlier. So the first exclusion, which is the EP has no office visits during the PI reporting period, is available to providers in Arizona. However, the second exclusion, which is the broadband availability, is not available to providers in Arizona. The documentation that would be needed to meet the measures would be percentage-based standard documentation, which is discussed on slide 14. However, there is additional documentation that may need to be submitted. If the provider is attesting to measure 3, explanation of what patient-generated health data is being utilized and how the CERT is capturing that data will need to be submitted. Some examples of supporting documentation to meet this measure is included in the documentation retention webinar link. Moving on to the exclusion documentation that will be required. Again, if the EP has no office visits during the reporting period, they would need to submit additional documentation to show the place of service code for all encounters during the PI reporting period. And again, the next exclusion, which is the broadband access exclusion, is not available to Arizona EPs. For additional information, you can click on the Coordination of Care webinar link at the bottom to look at more information regarding this objective. Moving on to Objective 7, Health Information Exchange. The objective is the EP provides a summary of care record when transitioning or referring their patient to another setting of care, receives or retrieves a summary of care record upon the receipt of a transitional referral or upon the first patient encounter with a new patient, and incorporates summary of care information from other providers into their CERT using the functions of a CERT. Measure 1, for more than 50% of transitions of care and referrals, the EP that transitions or refers their patient to another setting of care or provider of care. 1, creates a summary of care record using CERT, and 2, electronically exchanges the summary of care record. For measure 2, it is for more than 40% of transitions or referrals received in patient encounters in which the EP has never before encountered the patient. He or she incorporates into the patient's EHR, electronic summary of care document. For measure 3, it is more than 80% of transitions or referrals received in patient encounters in which the EP has never before encountered the patient. He or she performs a clinical information reconciliation. The EP must implement clinical information reconciliation for the following 3 clinical information sets: 1, medication; 2, medication allergy; and 3, current problem list. This is very similar to the last objective we discussed, which is where the EP must meet the minimum threshold for 2 of the 3 measures. If the EP meets the criteria for exclusion from 2 measures, they must meet the threshold for the 1 remaining measure. If they meet the criteria for exclusion from all 3 measures, they may be excluded from meeting this objective. This table goes through a few scenarios of where a provider may fall and whether they pass or fail. Again, with exclusion, the providers will need to submit documentation for how he or she meets the exclusion. There are 3 types of exclusions available for this objective: the number of patient transfers criteria, where the EP is the sender; the broadband criteria; and then the number of patient transitions and referrals criteria, where the EP is the receiver. An EP may take an exclusion if the EP meets the exclusion criteria applicable to the measure in the table below. In the far left column, it shows the applicable measure. And then in the right column, it shows what that exclusion is. So for the first exclusion, it says an EP transfers a patient to another setting or refers a patient to another provider fewer than 100 times during the PI reporting period. This applies to measure 1 only. For measures 1 and 2, which is the second row, that is the broadband availability exclusion, which is not applicable to providers in Arizona. The last exclusion is the total transitions or referrals received in patient encounters in which the EP has never before encountered the patient is fewer than 100 during the PI reporting period, and this applies to measures 2 and 3. The documentation that is required is the percentage-based standard documentation, which you can see on slide 14. Examples of the supporting documentation that would be acceptable can be found in the documentation retention webinar. The exclusion documentation is the EP transfers a patient to another setting or refers a patient to another provider fewer than 100 times. That is for measure 1 only. Moving on to the third exclusion, which is for measures 2 and 3, it is total transitions or referrals received and patient encounters in which the EP has never before encountered the patient is fewer than 100. That applies to measures 2 and 3. Now, these 2 types of documents I'm about to talk about apply to any of those 2 exclusions that I just mentioned, where it was less than 100. So there's the standard documentation that the provider can submit, which is the CERT dashboard, showing that the EP had fewer than 100 qualifying transitions, referrals, encounters for the appropriate measure during that PI reporting period. The second type of documentation that can be submitted is alternate documentation. This would be other than the CERT dashboard that demonstrates the EP had fewer than 100 transitions, referrals, or encounters for the appropriate measure. Now, that last exclusion towards the bottom is the broadband access exclusion, and it is not available to Arizona EP. The link at the very bottom is the Health Information Exchange webinar, and you can go to that link and it will discuss additional information regarding this objective. Moving on to Objective 8, Public Health Reporting. The EP is in active engagement with a public health agency or clinical data registry to submit electronic public health data in a meaningful way using the CERT, except where prohibited and in accordance with applicable law and practice. An EP must satisfy 2 of the 5 available measures for this objective. If the EP cannot satisfy at least 2 measures, they may still meet the objective if they qualify for exclusions from all measures they cannot meet. Measure 1 is the immunization registry reporting, and the EP is in active engagement with a public health agency to submit immunization data and receive immunization forecasts and histories from a public health immunization registry. Keep in mind that EPs must exchange data bidirectionally to meet this measure. Measure 2 is the syndromic surveillance reporting. It's when the EP is in active engagement with a public health agency to submit syndromic surveillance data. Measure 3, electronic case reporting. The EP is in active engagement with a public health agency to submit case reporting of reportable conditions. Measure 4 is the public health registry reporting. It's when the EP is in active engagement with a public health agency to submit data to public health registries. Measure 5 is the clinical data registry reporting. It's when the EP is in active engagement to submit data to a clinical data registry. Here's a listing of the available registries in Arizona. The first one for the Immunization Registry, it shows that you would reach out to ACIS, which is the Arizona State Immunization Information System, to meet that measure. For the second measure, which is the Syndromic Surveillance Registry, it is not available to EPs in the state of Arizona. So you are able to take an exclusion for that measure. But keep in mind, if you take an exclusion for a measure instead of meeting the measure, you would need to exclude from all remaining measures or meet them. For measure 3, the electronic case reporting, this is not available to EPs or EHs, and providers are able to claim the exclusion for this measure. For the public health registry reporting, there are a couple registries that are available. So the first is the Cancer Registry, which is in the state of Arizona. There are certain criteria that you have to meet to be able to submit data to that registry. So make sure you meet those requirements. The other list of where you can find the registries is to research national public health registries related to your specialty. So if you're a pediatrics doctor, you would want to go and look for registries that potentially you'd be able to submit your data to for the children that you see. The fifth measure is the clinical data registry reporting. And there is the link right there, which is the CMS approved quality clinical data reporting registries for program year 2021. So you can go to that website and look at the available registries to see if any of them would be applicable to your practice. Again, when discussing exclusions, the provider would need to submit documentation for how he or she met the exclusions if they attested to them. There are multiple different exclusions available for Objective 8. The first one is do not administer to the population. Second, do not diagnose or directly treat reportable diseases collected. The third is when the EP registry is not capable of accepting in jurisdiction. The fourth is that data is not collected in the jurisdiction for that registry. And the last one is that the registry has not declared readiness. An exclusion for a measure does not count towards the total of 2 measures. In order to meet this objective, an EP needs to meet 2 of the total number of measures available to them. If the EP qualifies for multiple exclusions and the remaining number of available measures is less than 2, the EP can meet the objective by meeting all of the remaining available measures and claiming the applicable exclusion. Available measures are ones for which the EP does not qualify for an exclusion. The EP does not operate or is not required to operate or operates in a jurisdiction where the applicable data is not collected for exclusion 1. Measure 1 is that they do not administer immunizations to any of the populations for which data is collected. Measure 2 is that the provider is not in a category of providers for which ambulatory syndromic surveillance data is not collected. So basically, these providers, to meet this exclusion 1, they are not collecting that data that is applicable to that registry, for which the registry is collecting data. For exclusion 2, if the appropriate exclusion can be claimed if at the start of the PR reporting period, the EP practices in a jurisdiction for which Measure 1, no immunization registry is capable of accepting the specific standards required to meet the CERT definition. For Measure 2, no public health agency is capable of receiving electronic syndromic surveillance data from EPs in the specific standards required to meet the CERT definition. And that goes on and applies to Measures 3, 4, and 5. So if the appropriate registry is not capable of accepting that data in a specific standards required to meet the CERT definition, the providers can claim the exclusion. For exclusion 3, the appropriate exclusion can be claimed if 6 months prior to the PR reporting period, the EP practices in a jurisdiction where the appropriate registry has not declared readiness to receive data. So for example, Measure 4, it says no public health agency for which the EP is eligible to submit data has declared readiness to receive electronic registry transactions. The documentation that is required for meeting those measures is the yes/no standard documentation. You can also go to the Public Health Reporting webinar and look for additional information regarding each of these measures and the exclusions that providers are allowed to claim. For the exclusion documentation, you would have to submit the additional documentation for Exclusion 1, which would be to explain and document why the EP does not or is not required to collect the data for the applicable measure in their jurisdiction. The second additional documentation applies to Exclusions 2 and 3, which is an EP must complete 2 actions in order to find available registries to be able to claim the exclusion. So first, the EP must determine whether his or her jurisdiction endorses response to the registry, and 2, determine whether a national specialty society or other specialty society with which he or she is affiliated endorses or sponsors the registry. And you'd want to document how you discovered that. This is just a reminder, in addition to meeting the ME requirements discussed throughout this presentation, the EP must meet all eligibility requirements of the program, including the minimum Medicaid and/or needy patient volume. To learn about those eligibility requirements, use the following documentation retention webinar link to see what those documents are and requirements. Keep in mind the patient volume reporting period for program year 2021 is any continuous 90-day period between January 1st and December 31st, 2020. To access all of these webinars, they will take you straight to the Access website, where then you'll be able to look through the different webinars and the frequently asked questions document. We'll briefly go over just the audit findings for if the providers are selected for audit. So all providers that receive a Medicaid incentive payment could potentially be selected by Access for post-payment audit. If you are selected, a post-payment analyst will conduct a thorough review of the documentation attached to the EP attestation and EPIP to determine if it meets the program requirements, and then Access may have follow-up questions or make additional documentation requests. Some common audit findings is failure to provide sufficient documentation for protecting electronic health information. 2, the CERT dashboard does not show the PI reporting period or EP name. 3 is failure to maintain proper documentation and practice no longer have access to the CERT. The 4th is supporting documentation does not have the appropriate dates. And then the last common audit finding is including data for the entire practice in the reported CERT report rather than data for the individual EP. Keep in mind that these are not the only audit findings, so make sure you're following the requirements and documentation specifics that we have put throughout this presentation. Here are some resources and links that you can go to, such as the Program Year 2021 Stage 3 tip sheet and any other links that we've put throughout this webinar. They're all on this resource slide and you have access to it. I know we are nearing the end of the presentation. If you do have any questions, please feel free to put them in the chat box. Christine, have we had any questions yet?
No questions have come through at this time.
Okay, perfect. Thank you, Christine. I know we have about 2 to 3 minutes left in the presentation. So again, if you have any questions or want me to explain something, I'm more than happy to stay on and answer those questions for you. We have just a couple minutes left. I do want to show you the Stage 3 FAQ that was created with this webinar that you can access. And basically there is 7 pages in this document, and it just walks through different questions that you may have and then the answers to those questions. So for example, question 2 is, when does an EP have to implement 2015 Edition Cert to attest for program year 2021? The answer is that 2015 Edition Cert must be implemented by the first day of the PI reporting period. The cert must be certified by ONC as a 2015 Edition product by the last day of the PI reporting period. And then it gives you the ONC website link to learn when various cert products were certified. So if you do have questions after this webinar, this would be a great resource to go to see if that question is already answered here. We just have a few minutes. So if you do have any questions, feel free to put them in the chat box and we can answer that. And I can even explain anything that we've already discussed or potentially have not discussed yet on this call. Keep in mind that we briefly touched on the patient volume requirement for program 2021. That question in this document is question 3. Are EPs required to meet the patient volume requirement for program year 2021? The answer is yes. The EP should select a 90-day patient volume period within calendar year 2020, and the EP must have either greater than or equal to 30% Medicaid patient volume, or 2, greater than or equal to 30% needy patient volume if practicing predominantly at an FQHC or RHC. And if there are no more questions, Christine, in the chat box, I will hand the presentation back over to you.
Okay, thank you so much, Priscilla, for sharing this information about the program year 2021 Stage 3 requirements. We have not received any chat questions yet. There's about another little minute to go with today's presentation. So again, the chat box is open and we've got some really great folks on the line to help answer those questions you might have. There's also access as well as Health Currents telephone numbers and email addresses to ask questions to them directly. And with that, Priscilla, again, I will thank you for your time today. Thank you to everyone participating on today's call. We will be getting the slide deck and a link to the recorded sessions to you in the next day or so. Please join us for future webinars on the Access Promoting Interoperability program as well. Thank you again for joining us today. Have a wonderful rest of your week. Bye-bye.